Good afternoon, Klimax Family Hub. Dr. T. Ayodele Ajayi. I'm a consultant psychiatrist and also the convener of the Tripart Care Emotional Wellbeing Hub. And I'm really delighted this afternoon to be joining you by video recording to talk to you about the impact, the mental impact of friendships, peer pressure, drink, and drugs on our children. Um, Thank you for the great work that you are doing in the community. I'm particularly delighted and also really celebrate the work that Mrs. Kemi Tomide Johnson is doing in this sphere. I'm just going to, over the next quarter of an hour, share my thoughts and I'll be sharing my slides just now. Right. Okay. So that's my theme, building positive relationships, how friendships, peer pressure, drink, and drugs can affect mental health. And I think there are two things to define here. One of them is mental health, the first thing. And of course, the other one is peer pressure. And what is the relationship between these two? So as I've always said in the past, mental health is really defined by the World Health Organization. It's a state of well-being where somebody is able to fulfill their potentials. They're able to cope with normal stresses of life. They're able to work productively, and they're able to contribute to community, particularly for our children. Really, what that means is that if they are not in a good state of mental health, they are not able to fulfill their full potentials in life. And the key thing is that it's actually their childhood that lays the foundation and the bedrock for their mental and emotional well-being for the future. Science tells us, neuroscience tells us, for instance, that the brain continues to develop up until the age of 25. And that, in fact, the very crucial years, the very formative years of a person's life can be very key towards their future mental health. So I suppose the challenge that I want to throw to us today is really that everything we are talking about in terms of peer pressure, in terms of friendship, drink, and drugs, have a profound effect on a child's mental well-being going forward. And it's very important for us as parents to oversee those things in the earlier on in their lives, so that in the future they can reap the benefits. So what do we know about childhood and mental well-being before we go on to talk about peer pressure and friendships and drinks and drugs? We do know that the environment that a child grows up, the experiences that they have, the education, that the type of education that they have is actually what helps them to form their views about themselves, about others, and about the world. And that actually by the age of 14, 50% of mental illnesses have already developed, meaning that the very first those very crucial 10 years, 15 years are really so important. In fact, the first 2 years is very key, and then going forward, the subsequent years. So we do know also that 75% of mental problems would have developed by the mid-20s, and that 10% of school children have a diagnosable mental health condition. The point I'm trying to make here is that really this is the time for our children to really look into those things and make sure that they are forming solid foundations. So what is peer pressure? According to the Merriam-Webster dictionary, they say it's a feeling that one must do the same things as one's age group or one's social group in order to be liked or to be respected by them. So it's a pressure to belong. It's a pressure to really fall in line and to look the same and behave the same in order to gain liking or in order to be favored in the group. But the problem with that is if it's an antisocial behavior, if it's something to do with bullying other children, or if it's something to do with drinking or using drugs, it becomes an adverse childhood experience. And we do know that anything that is highly stressful, that is potentially traumatic, that occurs in the life of a child or an adolescent, whether very earlier on as a single event or as a repeated event, is detrimental to their well-being. And those things they are collectively called adverse childhood experiences. So bullying, peer pressure to do negative things, drinking, drugs, And so all of the things that we're talking about today actually constitute negative life, they constitute adverse childhood experiences. So what are the consequences or negative effects of adverse childhood experiences on children? Mental problems is key. For instance, we do know that if a child is exposed to cannabis use in their teenage years, that some of them are at more than 50 times higher risk of developing psychosis later on in life than people who are not exposed to cannabis. And those are the type of things we can share with our children to let them know that actually, and I also always say to young people or to their parents that actually a one-off use of an illicit drug can actually become problematic, just one-off. And this is not something that I've plucked off from fable books. It's actually something that I've seen in my clinical experience, where somebody had one use of an illicit substance and they ended up in hospital. They ended up having to nurse a psychotic illness for a while. And this is not just somebody, it's something that we see quite often. So it's important to share these things with children. All of those things can result in mental problems, depression, anxiety, post-traumatic stress disorder. All of those things can, if a child is bullied, for instance, that can result. So the other thing that can result from peer pressure, from use of drugs, from use of alcohol, is that physical problems could also develop, which can be detrimental to the child. And of course, if those children then become dependent, or their academic performance or their progression in life is affected, there's a knock-on effect on their outcomes in life in terms of their marriage. They could then develop difficulties in their relationships in future. They could have problems getting good jobs. They could have problems with interpersonal relationships. They could become victims of violence, and they could become perpetrators of violence themselves. But importantly, what is also important is that there's a generational impact, that if those things are not controlled, they could also pass it on to their own children. So the role of a parent is really very key in all of these things. Now, the point I really want to make, and I think this is the most important slide I'm sharing in this presentation, about peer pressure, about drink or drugs, helping children to deal with those things and prevent them. And that's the point. The most crucial point I want to make is this: that the parent-child connection is the most powerful mental health intervention known to mankind. So our relationship with our children is the most important intervention that we can give to them in terms of helping them with their mental well-being. That's the greatest investment that we can put into their mental well-being. And in the next few slides, I'm going to share with us the very practical things that we can do in terms of helping children with peer pressure, bullying, and also helping them with use of drugs and drink and drugs. So the next significant point that I need to make is that in terms of looking at our own parent-child relationship and how that can be an investment into the life of our children and into the emotional well-being of our children for the future, we need to look inwards first. If we don't invest in our own mental well-being, it's difficult to be in a strong place where we can then help children. Many, many times, a lot of parents who have mental difficulties themselves or unaddressed emotional problems will find that they are not in a good position to be open enough and to be emotionally available to help their own children when they face the challenges of life. So Professor Merino, some of us will know her well, she got it really right when she said that the greatest investment that we can make into a children's emotion, that a parent can make into a child's emotional wellness, is to attend to their own mental health and to address their own traumas. So we've got to put on our own face mask first before we can help our children. That's the simple message. So this is one of the final slides I'm going to share. What can parents then do to help children with peer pressure? And that peer pressure could be to bully other children, to be involved in any antisocial behavior, to run away from school or not attend classes or be disruptive or to get involved in drinks and drugs, whatever it is. There is a wide spectrum of things that negative peer pressure can let children do. But it's also important to bear in mind that there's actually positive peer pressure as well. positive peer pressure in terms of children being encouraged to get into sports, to get into music, to get into drama, to get into things that can be positive distractions for them just because somebody else in their social group is doing it. So peer pressure is not always a negative thing. There's a positive part to it as well. And we can utilize the power of positive peer pressure actually to help our children. So what can parents do as I round up? Teach children early about peer pressure. Let them know when before they even go to school. Begin to talk to them about those things and periodically talk to them about it. Use the opportunities of school runs, picking them up, dropping them off, talking to them about during dinner time to actually reinforce those messages. Teach them and role play with them how to say no. Because sometimes it can be, let's think about it, even for ourselves as adults, sometimes it can be daunting to say no. So role playing that with them, teaching them to say no, can actually give them the confidence to be able to do it when the time comes because they've done it at home with you and they've practiced over and over again. Share with them what's the what and the why of your family values. Let them know the consequences. For instance, I've talked about cannabis. Let them know the consequences of what their negative behavior could be, and that one flippant, silly act could actually be detrimental to their future. So it's important to reinforce that to them as well, and to let them know what your family values are and why you share them. Create an open door policy where they can, a lot of children, if they need to confide in somebody, so if they're not able to confide in their children, they will, in their parents, they will confide in their peers, and you know where that can lead. So it's important for us to have an open door policy where our children feel vulnerable enough, but they feel also confident enough that no matter what happens, no matter even when I mess up, I can still speak to my dad and mom about it. Reinforce good behavior at every opportunity. Let them know that you trust them, you have faith in them, you expect them to do well. Watch the language you use to in describing them. Watch the language, how you treat them. Treat them with honor and dignity, because children meet up, they live up to expectation. So if you have negative expectation about them, they will live up to that negative expectation. If you have positive expectation about them, they will live up to that positive expectation. And all of these are research-based. There's not enough time to go into all of this, but there is something called Pygmalion principle, which really studied this very extensively. So the other thing, and another key thing, apart from teaching them how to handle peer pressure, is about helping them to establish a solid and grounded identity. Help them to feel comfortable in their own skin. Help them to discover and celebrate their own uniqueness. Sit them down and help them to what are the things that are going well for you? What are the skills that you've got? What are the attributes that you've got? Help them to feel comfortable and celebrate their own uniqueness. That every one of us, 8 billion of us on earth, are unique, and we are gifted individuals. We've all come with a unique contribution, so that they don't feel inferior. They don't feel lacking in confidence. They don't feel that they have to conform and bend to the pressures of other people. That talks about helping them, and then monitor their online and offline friendships. So get to know their friends and the parents of their friends as well, so that you know who they're hanging out with. And sometimes you would have to be able to intervene to create some geographical dislocations in terms of really helping your children to associate with the type of people that you want them to associate with. So that's very important. And of course, there are so many apps online that are available these days where we can monitor children's online use. And the final thing is limit exposure to TV and to the internet. That can also be very damaging if that's not controlled. So I'm hoping that today I've been able to share a few thoughts to think about in terms of helping children to deal with peer pressure, to deal with drinks and drugs, and to form positive friendships, but also the negative impact that could have upon their well-being. And importantly, the key message is that the parent-child interaction is by far the world over the most important intervention that we can offer to our children in terms of their mental well-being. Thank you for listening, and I wish you further fruitful discussions and deliberations for the rest of the event today. Thank you, and goodbye.